Okay, my name is Kaylee Dyring, and this is the final for the lab pass-off. So what I'm first going to do is I'm just going to check with my patient Mona here on the MAR to see what she needs, and I'm just going to go over here into a room because we got to do a baseline assessment for sure, just to see how she's doing and everything, and then also look for other nursing considerations. Looks like she has no allergies. She does have oxygen on 2 liters, and she was unable to walk, but now she's able to get up into the chair and walk with her walker 3 times a day. She does have an IV in her right arm, and it does say that she does take lisinopril at home, so we're probably gonna have to give one of those, and then we'll see how she's feeling and if she needs anything else. So we'll go and do a baseline assessment. Hey Mona, my name is Kaylee, and I'm gonna be your nurse today, okay? Okay. Mona, I'm just gonna hurry and get some hand sanitizer on, close the curtain, and then can you give me your full name and date of birth? Perfect. I love the name Mona, actually. It's pretty cute. Yeah? Yeah. And so, how are you feeling today? You feeling okay? You have any pain? Feel like you have a headache? Okay, we'll see if there's any medications I can give you for a headache. What about medications? Are you on any medications? Okay, perfect. Well, we're just gonna be doing like a quick baseline assessment. And if you have any questions, please feel free to ask me at all. I'm just gonna make sure. Looks like your hose isn't anywhere crazy for you to trip. Make sure the room is safe. Looks like the bed is all the way down. The head is up. I'm just gonna lift you up just a little bit while I do this baseline assessment. So you take 1 medication at home, is that correct? Yeah? Okay, perfect. And it's for, yes, high blood pressure. Perfect. Okay, so what I'm gonna first start out with is I'm just gonna feel your head, see if there's any abnormalities. Okay, perfect. And then I'm just gonna feel around right here in your lymph nodes. Everything feels normal. Okay. And you're not in any pain, right? And if I do touch anything and it hurts, will you let me know? Perfect. And if she wasn't in any pain, I would go over Caldera, which is characteristics, onset, location, duration, exacerbation, relief, radiation, and any other symptoms, but associated symptoms. And so, Mona, what I'm gonna have you do is we're gonna check your pupils. I don't know if she can open her eyes, but if she were to have her eyes open, what I would do is I would have her close her eyes, open them, perfect. Close your eyes, open them, perfect. Okay, and if her pupils were dilating and equal, it would be pupils are equal, round, and reactive to light and accommodations. And then Mona, I'm gonna have you follow my pen right here, okay? Don't move your head, just follow the pen with your eyes, okay? Perfect. Looks like her eyes would probably be following the pen as well. Okay. And then what I would do is I would just make sure and check up her nostrils, make sure everything's looking good, her throat, ears. Have her turn her head. Everything looks good there. Okay. Next one, I'm gonna just bring this down just a little bit, and then I'm gonna check your chest. Do you have any chest pain anymore? They said when you came in that you had a little bit of chest pain. Okay, not anymore. Perfect. Okay, so I'm just gonna look just a little bit, observe. Looks like if she's breathing, it's equal as well. What I'm gonna do, Mona, is I'm just gonna listen to your heart. There's gonna be 5 places: aortic, pulmonic, Erb's point, tricuspid, and mitral. Mitral I'm gonna listen to for about a minute, okay? Aortic, pulmonic, Herb's point, tricuspid, mitral I'd listen to for a minute. Then I'd have a watch and I would time it for an actual minute. But for sake of time, we're just gonna skip that. Next, we're gonna just listen to your lungs, okay? I'm gonna listen to 6 points on the front of your chest, and then we're gonna have you lean up and we'll listen to 6 points in the back. And then while I put my stethoscope on, I'm just gonna have you breathe in and breathe out, okay? Just a big deep breath. Okay, breathe in, breathe out, 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 breathe in, breathe out. So, are you having any troubles with like breathing or respiration, coughing? Yeah? Okay, well, we'll look and see if there's anything we can give for that as well. Okay, I'm just gonna listen to 6 more spots on the back, and then we'll be good listening to your lungs. Okay. Breathe in, breathe out. 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 Perfect. Thank you, Monica. Or Mona. Okay, so now what we're gonna do is I'm just gonna pull this down just a little bit further, and I'm gonna check your abdomen. Do you feel like you're having bowel movements? Pretty good bowel movements? Yes, they've been pretty regular. Perfect. What about urine? No, you feel like you haven't been able to pee for a little while. Okay, we might have to get we'll see on the orders. We might have to give you a Foley catheter, okay? I also, while I was talking to her, I saw that she had she was smiling, no drooping or anything, so no signs of stroke that way. I was also able to talk to her, and she seemed like she was pretty well aware where she was at. I also had someone that was able to come in and check on her vital signs, and I looked at that at the MAR, and they looked normal. Nothing to be worried about. And they said that ambulating, she does need a little bit of assistance, but she does pretty good with her walker. So on to the abdomen. What I'm going to do is I'm just gonna first of all look and see if there's any abnormalities. It looks like there's no abnormalities. Now I'm just gonna listen to your bowel sounds, okay? In the 4 quadrants. Perfect. Okay, your bowel sounds seem normal. I'm just gonna palpate. Tell me if you have any pain while I do this, okay? Okay. Nothing seems like nothing seems off. It seems all pretty normal, okay? Doesn't hurt at all? Okay, perfect. Perfect, perfect. Okay, now what I'm gonna do is I'm just gonna check all like your skin, make sure you don't have any wounds, right? It looks like there's nothing on your back besides this little metal piece, but I think that's okay. Pretty normal. Everything else looks good. Skin trigger looks good. You don't have any other wounds, any sores. You feeling tender on your bum? No? Okay. I'm just gonna look at your legs right here. Legs look pretty normal. Does that hurt at all? Can feel no edema. Okay, now I'm gonna have you squeeze my fingers. Pretty normal. I'm gonna look at your capillary refills. It looks like it's less than 3, which is normal. Okay, I'm gonna have you, pull back on my hands, okay? Perfect. Now push on my hands with your feet. Perfect. I'm gonna just feel your distal pulses. Feels normal. I'm gonna feel your pulses right here. All feels normal. If there were to be a wound, I would look for odor, amount, type, but looks like that you don't have any issues with that. Okay, so I'm just gonna cover her up. I do know that she does have a cannula, so there are a few hoses, but nothing. She's on 2 liters. It looks good, and no Foley catheters or anything like that. So, okay. Well, I'm gonna go and look at your orders and see if there's anything we can get for your headache, and also to see about the cough and get you your high blood pressure medication. Okay? Okay, I'll be back in just a second. I'm gonna leave. I'm gonna do actually hand hygiene before I go. And I also could put gloves on if I needed to during the assessment. Okay. I'm actually gonna put this over this way. And then I'm gonna go get the medications right now. So in the MAR, it actually has a couple of medications we can give. Ibuprofen, guaifenesin, which is for her cough. And then we also have the lisinopril, which is for her high blood pressure, and it's given, looks like, in the AM. Okay, so what I'm gonna do is I'm gonna open up the med cabinet. I'm gonna grab the meds that she needs, and I'm just gonna make sure with MAR, ibuprofen, looks like this is 200, so, and she needs 600, so we'll give 3 of these. And then lisinopril, we just need to give 1 of these, and then we'll drop in a syringe 5 milliliters. Yes, 5 milliliters. So I'll bring my syringe. Usually it's covered. We'll pretend like it's covered. And then she does have a order to put a catheter in, Foley catheter, into 1 catheter. Okay, I'm gonna grab these. We closed that med cabinet so no one can get in there. We'll put all these on here. And then we'll bring it over. Did my first check. I'm just gonna check again, make sure we got the right one, and also make sure the expiration date is fine. We're also gonna check the patient. Hold on. We're also gonna check the patient drug dose, route, and time, and we've already checked all of those. So now we're gonna go in to the patient's room. Knock, knock. Hey Mona, I came back with some of your medications. I got some pain relief, ibuprofen. I got some cough syrup for you, and then I also have your lisinopril, which is for your high blood pressure. I'm just gonna close the curtain for privacy again. I'm just gonna make sure you're Mona, right? And then birth date. Perfect. Thanks, Mona. I'm just gonna get some hand sanitizer, get some gloves on. I also forgot a little med cup. Hold on. I'm gonna grab that med cup. Get some more hand sanitizer on. Perfect. I'm only going to be doing one patient at a time while I get the medications, making sure the med room's locked. I'm double checking the MAR, which I've done twice now. And so I'm going to scan one more time and look at it again for my third check. So right now I'm going to give you the lisinopril, which is for your high blood pressure. Oops. Okay, and I'm just giving one of these. And then I also have your water cup, so you can swallow it too. I would also look for any other nursing considerations as I was looking at the MAR, making sure no allergies. Do you have any allergies? Nothing that you know of? Okay. So I'm gonna help her take this, make sure I'm watching the med go down. Perfect. Gulp, gulp. And then what I'm going to do is I'm gonna get some ibuprofen for your headache. And I'm gonna give 3 of these to her. Because she needs 600 milligrams and these are 200 milligram tablets. Okay. I forgot to scan. Make sure to scan. Barcode. And then scan for ibuprofen for the third check. You gotta make sure to do this. Perfect. And then I would administer the medication. Gulp, gulp, gulp. She took 3 of those. Perfect. And then I would just push administered. We checked patient drug, dose, route, time. Completed the 3 checks. Birth date, administered. I would also do that to her. Lisinopril. Scanning this. Checked all of my things. Got birth date. And then administered that. So now my last one I need to do is getting 500 milligrams of her cough medication. So I would just go like this. 500 milligrams, or 5 milligrams. And then I would help her insert it into the side of her mouth. But I don't want to do that now. And then before giving her the medication and giving her a drink, I would make sure to scan this. Perfect. And I did the 3 checks with this as well. Dose, route, time. I checked all the expiration dates and I administered. So all of that is completed. And I also didn't mention this, but after my baseline, after I do all this, I'm going to document, and I also am going to tell the patient why I'm giving it, which I did, and then any adverse drug effects that might happen as well. Mona, we do have one more thing we got to do, which is inserting indwelling catheter. So I'm going to go get my things that I need, and I'll be right back, okay? And we'll see how that medication's working for your headache and everything else, okay? Perfect. Okay, thank you so much. If you have any other questions, let me know. And then I'm gonna go out, unlock that med drawer. I would also throw away my gloves and and hand hygiene. And then I would put all the medication back, lock the drawer, and I would also leave the beds or the water at the bedside and make sure to close the curtain every time. Now I have all my stuff for an indwelling catheter. So I'm gonna come over here and make sure with the MAR that I'm giving this, indwelling catheter for urinary retention. Okay, I'm also gonna put this over, throw it away usually, but gotta keep them. Okay, so what I'm gonna do is I'm just gonna take all this stuff over to here. Hey Mona, we're coming to do a indwelling catheter, okay? Perfect. I'm just gonna grab this other bedside table so then I have some extra room to open up my sterile gloves. I'm gonna just take off my watch. Okay Mona, you might feel a little pressure down there, but we're gonna make it as fast as we can and as smooth as we can, okay? So I'm just gonna lift this up. What we're first gonna do, make sure we close the curtain, hand hygiene. Don't have any allergies, right? Okay, to latex especially, or iodine? Nope, okay. Okay, what I'm first gonna do, Mona, is I'm going to put your legs in a position where I can do this catheter, okay? It's called dorsal recumbent, kind of like frog legs. And I'm just gonna lift this high enough. I already have this chuck underneath. And then I'm gonna do some peri-care just to make sure that that's clean as we do this boy catheter. Perfect. Okay, it's gonna be a little bit cold, so just be aware. Spread it open, do one side, get a new part, do the other side, okay, and then right down the middle. Perfect. I'm gonna throw that away, put this aside. Okay, now I'm gonna take these gloves off. Okay. Just gonna throw this away. Make sure I date and time my catheter. And then I'm going to open it like that. I'm gonna first open it. Oh. Got to open it away from us. And around this edge, we have about an inch where we can use there we go. Perfect. Now I'm going to put on some of my sterile gloves so I can touch inside. And then we have an inch around these. Perfect. Okay, so I'm just going to grab the outside of it right here. Perfect. And then I'm going to grab right here on the inside. Okay, I'm gonna put this on the side right there. And then I'm gonna grab this. And I'm gonna put this underneath the patient. Perfect. And I'm gonna place this over the patient. This helps if you do accidentally squirt them or anything, and it can cover them. Perfect. Okay. Now I'm just gonna open everything up so everything's ready. And if we do need a specimen, we can get that as well. This is just a second one if we need it. And then we also have our lubricant. Where's our end piece? Perfect. There we go. We'll just throw that away. Throw that away. And we'll put this in the lubricant. You want to get 2 to 4 inches about. There we go. Sorry, Mona, we're just getting all prepared and ready for this so that it goes smoothly. And then I am just gonna, where's this saline? There it is. Throw that away, put that on, just so then we're all ready. Okay. And I'm gonna put this right in the middle of your legs, okay? Perfect. Okay, now what I'm gonna do, Mona, is I'm just gonna wipe you down with these little iodine swabs. There should be 3 of them in there. Perfect. Okay, so I'm just gonna hold labia open, do 1 swab down the side, throw away. Do 1 swab down the other side, throw away. Then do another swab down the middle, throw away. This hand is still sterile. And what we're gonna do is we're gonna take this piece of the catheter out. Perfect. We're gonna open her up. Then we're gonna insert. Perfect. Okay, now what we're gonna do, since it's in and I can see urine, we're gonna insert 5 milliliters of this saline. Perfect. Because that's what the Foley required. And then we're just gonna pull back, make sure that there's retention on there and that it's in. Then we're gonna slightly, we did it. Make sure that that doesn't squirt them, which was pretty good. I'm gonna throw this away, throw this away. Nothing's really sterile now. I'm gonna keep that though, just in case they need it. Throw it away. And then we're gonna drape this on the side. And I have a little catheter secure kit right here. That's gonna go right on that leg right there. And then we're just gonna throw this away. Throw all this stuff. We would take the blue check out. So all of that's done. Do you feel good? Does it feel like it's in? I know, I'm sorry. What I should have done when inserting the Foley is just making sure she knows that it's going in, and it might hurt a little bit, but just breathing out helps. Breathing in and out. Okay, so I stuck that thing to secure the catheter right here. It's not gonna stay And then I'll just make sure she's covered up. Also, I would, if she did have iodine on, make sure to just wipe around, clean the area up with another towel. And then I would also date and time my catheter, put it on there. I also can get a urine specimen if I need to, the very first of the urine when it comes into the bag. And then I would clean everything up. Also, forgot all of this, but just making sure that they're at a comfortable position. And when you do leave the room, make sure the side rails are up and the patient's all the way down. She was fine at this angle, but I probably would have been better off if I lowered her head, but the head is not going any lower. Oh yeah, now it is. But just lowering her head mostly to the ground, and then when she's taking medications, make sure she's pretty high up so she's not choking on any of those medications as well. And just making sure you throw everything away. Hand hygiene. Make sure the water is where it needs to be, right next to her, and that she's in a comfortable position, that she feels like she's doing okay. The medications were given. I would ask and see if she, if they're kicking in, if her head feels better, and then I would also come and check on her after just to make sure her Foley's feeling okay as well in an hour or two. Same with the medication. Yeah, and then I would go document everything that happened.